Good afternoon. My name is Dean Mazzarella, Mayor for the City of Leominster. It is March 25th, 5 minutes past 4. We were trying to let the state press conference update, but we're a little bit of an overlap. We apologize for that. We'll give you the latest numbers. They just have been released. Confirmed cases in Massachusetts, 1,838. In Worcester County, it's up to 129. Here in the city of Leominster, the number is 6. So I'll repeat that. Statewide, 1,838. Worcester County, 129, 6 in Leominster. Patients that were hospitalized, 103. That's only up a few. That's a good signal there if you're looking at the data here and keeping track. And patients that were hospitalized is up to 103, but that's a slight increase. And patients not hospitalized is 350. So those are good numbers in terms of growth. Not good numbers because we don't want people in the hospital, but in terms of watching the data and seeing what kind of increases we have, they are better than expected, or at least on my interpretation. Total patients tested now is up to almost 20,000. And out of that 20,000, 1,838 have tested positive, and we'll keep watching those numbers. More and more patients are being tested. More and more sites are going up, and extended hours at Health Alliance in Leominster. Reliant went up, and so the information that we're looking for, I don't know that we can get it from this data, is the people that are testing. It doesn't look like it's an overwhelming amount of people who are testing positive that need to be placed in the hospital. That's a good sign thus far. What we need to know is the condition of those that are being tested now. We know that a week and 2 weeks ago, they were only doing testing for the people with the worst cases. So is that improving? Or is that getting worse? Based on these numbers here, again, 20,000 people have been tested, 1,838. I'm not saying this means anything. I'm just looking at the data, and it is better than I thought at this point. But we'll have to see as testing increases. The governor did announce today, and this is what's new. We'll try to bring you what's new here locally. All schools will be closed through May 4th. And that is a little bit of a setback. I think most parents were making plans, teachers, everyone was making plans for the beginning of April. That has now moved forward by almost another month. Children cannot lose. They cannot retain what they've learned all year. They can't lose what they've learned all year. So we really need, and it's a little disappointing because I thought when the state was on part of the press conference, when the Secretary of Education was speaking, that they had a plan to tie us all into some sort of a network for online learning. And I had posted the other day on Facebook, and there were a number of platforms and software packages that other states, people that either lived here, have relatives here, had suggested. But we really, in a conversation I'll have with the superintendent tomorrow, and it's a little bit texting back and forth today, we've really got to get to some sort of a regular learning day and get back to what the lesson plan was. Teachers worked from August all the way until the beginning of March here. They have a very regimented plan almost to the day, to the minute, in terms of the education environment and the plan that they have. They know exactly where students need to be by day and week. They know what students need to achieve by the end of the year, and they know they're relaxing the testing, but that really isn't helping anybody. It's not the testing I'm concerned with. I'm concerned with retention, that the students lose everything or a lot of what they were taught over the school year. And so we've got to get to some sort of a regular school day online. And I know that there are partnerships between WGBH, and there are museums, and there are plenty of things that people can do. But again, that doesn't get back to the original lesson plan of the teacher that started out in their classroom, back in August. So tomorrow I hope to sit down with the superintendent and go through. They do have a number of tools that they can use, but I really want to push to get every student some sort of electronic device that they can learn on and make sure they have internet access. They're also extending the closure of daycare. Again, WGBH is televising programming for education, noon to 5 every day. I don't know what that looks like. The Worcester Art Museum has great art and education activities. And again, this is sort of student-based learning sort of things. But again, what gets back to, this is what we were working on in history, or this is what we were working on in math. What gets us to that point where we can have what's as much as a normal day of learning? How do we get that platform to our students? And that's the conversation we'll have tomorrow. But this is really where, from the first day that we're talking to, anybody was talking about closing schools, this is exactly what I thought was going to happen. They keep pushing the date out. Now we're to May 4th. Our parents are going to have to plan for that. And as it is now, child care centers are closed. And this is okay for a week or two. And I want to be optimistic, but at the same time, we've really got to plan out for what happens if. And you need to do that at your own home, because as sort of federal money comes, we're not quite sure how that's going to impact our local community just yet. We don't know what the application process will be. We don't know how much will be given to local businesses. But what I do know is it's sort of a risk management issue. Do you let the economy completely fall apart? Or do you let the country go into more of a deficit and spend trillions, that's trillions of dollars to keep things going? And we still don't know, by pumping in trillions of dollars, what all that means. But what I do know is that we need to get back to some sort of a normal education day in a learning environment, similar to what teachers were already teaching, and we need to do that online because we don't have many other options. And while I understand museums and there are other pages out there that might be helpful, that's not what was in store when we opened schools in August. So that's work in progress, but we've got to move forward and move quickly, get kids connected to the internet that don't have it, get people a device and families that don't have it. Let's get them connected because time is of essence, and obviously they've already moved this. We didn't even get into April, and they've already moved it to May 4th. 400 centers are approved for over 8,000 kids of emergency workers. So those in the emergency world, there are now 400 centers that are approved for 8,000 students. New assistance for homeowners, renters facing home loss, postponement of foreclosures for 60 days, new guidelines for grocery stores, including guidance for social distancing, and that's all available on mass.gov. So if you didn't see the governor's press conference, those are some of the things that he and his administration spoke to. Important numbers, let me just hit you with a few slides here. And again, we'll try to post this all up, and this is on my Facebook. So this, if you just click on my Facebook later, I save it, you can get on it. Same thing with Leominster.tv, and they also archive it and put it up on YouTube. And the same thing with 95.1, which is WLPZ, that's Leominster's radio station. Again, they repeat this during the entire day, and they will repeat this very segment. There's the important phone numbers there, 978-534-7500, extension 0. That's our office. Emergency Management, 978-534-7500, extension 5055. Meals on Wheels, 978-424-7548. Veteran Center is open. Statewide hotline is 211, and for emergencies only 911. Mott is going to be on a limited Council on Aging rides. They will take you to grocery stores, medical appointments, and pharmacies. This will be effective starting today, going through April 7th, but I think it'll be longer. Mott will also not be charging any fares during this time, but you must call 978-534-7511 so we can schedule you. Yes, trash will continue. Trash is going on. I do have to get back to you in terms of if we have a good weekend or a couple nice days, people be in their yards. Wendy or somebody in my office, if you're watching this, can you check with somebody from the health department? Are we going to continue to do the whole yard and waste yard waste leave pickup. That would be a good thing to find out. There we go. City Hall is here for you. We are open. It is important. I think, my opinion has always been, we use taxpayers' dollars, and everyone who is paid with taxpayers' dollars are essential employees. We are local government, even though the building is actually closed. We are local government. We're operating via the internet, Skype, whatever it is that we have to use, whatever applications are used. We are constantly in contact with different agencies, other communities, changing ideas and best practices. Somebody had asked before if they could leave out trash because we're all home all day. Yes, checking on that, but I think we're actually a little bit gone already over our budget in terms of trash removal for the fiscal year. But anyway, City Hall is open. We're here to help you. There's a list of phone numbers that you can find if you should come to City Hall. We have the list on the window, but we have a whole phone tree. If you just call 978-534-7500, you will get the entire list of phone numbers and who to call. And again, we are open for business. The doors are locked, but we are open to assist you when we have, giving out building permits, whatever is necessary, helping businesses that need to be open, Health Alliance, Reliant, whoever needs our assistance. Showed you the school department's numbers. They still did almost 1,000 meals today. Great job, great partnership with Chartwell's, and that will continue on. Here's a little bit of the stimulus. Again, we do not know how this is going to definitely impact us, but we will know soon as that money heads towards different states and then filters into communities. New event. Hey, this is pretty cool. We realize that some businesses cannot open their doors, but they can operate virtually. And we stay home, and maybe there's just another way to do it. Yes, there is. Help support Leominster independent retailers from the comfort of your couch. You can even wear your favorite pajamas. We don't judge you. You could put a baseball cap on if you want. But anyway, here are some of the participating stores here in the city of Leominster that you can go online and do your shopping. Cutie Patooties, Consignment, Cutiques, Forces, Time Capsule, Hall of Fame Leominster, New Whalum Cooperative, Northeast Promotion and Apparel, Sage Home Collections. Please note this event is scheduled to run towards April 7th. If your business is offering online shopping and you would like to be included in this list, you can email Melissa Tasker at mtasker@leominster-ma.gov. And again, you can always call City Hall at 978-534-7500, extension 0. Kids Edition tablets. We have these available. The school department superintendent send them over today. They are available for loan. We have a limited amount, so if you do not have an electronic device, this would probably be right up your area. So if you already have an electronic device and you're already you have a tablet, then probably leave it for somebody else. And these will be available for loan in our office. Call 978-534-7500, extension 0. These are the cases, but we have an updated list that I shared with you. United Way is launching the United COVID-19 Fund. So they're raising money, but also giving money back out into the community. Funds will assist local agencies to help those hardest hit with childcare and housing. 100% of every donation will go towards helping the communities that they're in. Grants will be made to help families impacted by COVID-19 to meet basic needs. It'll also help local agencies to continue their good work on behalf of area residents. So you can go to the United Way website and have all this information there. Done in 2 phases. Updates from the governor. Testing in Massachusetts has dramatically increased. And again, as of yesterday, there were 14,000 people that were tested, and now we are just about at 20,000 people with about 1,800 cases. 10 additional labs are up and running, more sites to come. 89 deliveries of supplies have been distributed to the state. And so the materials and the badly needed personal protection equipment is arriving. There's going to be more flexibility in terms of, as I said, testing from the Mass School. Dessie is what we call it, but it's basically the Secretary of Public Education. There are a lot of questions about graduation and modification of MCAS requirements, but to me that is minor compared to getting a platform out there where students can continue to learn. If they want to learn at 6 o'clock at night or 2 in the morning or whatever it might be, is to get that out there. And again, we'll have that conversation tomorrow. Permitting, flexible in permitting. The state's trying to give us the tools that we need so that we're not in the way and interfering with helping you or businesses. Here are a couple other proposals from the governor regarding police and fire to allow retirees to come back to help fill in the gap if emergency personnel becomes ill. Search warrants can accept electronic signatures from authorities rather than in person. Businesses, there is a consideration to allow businesses to be able to do takeout beer or wine if they're a takeout restaurant, and so much more that the state is working on in terms of getting certain legislation passed. Catholic Charities has their thing going as well in terms of helping out the community. They are here in Leominster. Their hours will be Monday, Tuesday, Thursday, and Friday, 8:30 to 4:30 by appointment. There's the phone number. They're helping out every day. They're adding different items that they're helping with, diapers and a food pantry and hygiene materials. Case management will be done on over the phone by appointment. If it's a new client, a short intake will be done over the phone. At the moment, they are not accepting any more clothing donations, and the clothing area is closed until further notice. But you can go to their website. Again, everybody has a website, ccworc.org. Ginny's Helping Hands took a little bit of some time off, but starting this week, March 30th, starting the week of March 30th, I apologize, food pantry hours will be Tuesday, Thursday, and Saturday, 10 to 1 o'clock p.m. Businesses that, most of the day, I have to tell you, is spent with businesses who are calling, substantiating and verifying why it is that they need to stay open. Some have federal status, but many of the businesses that are staying open, beyond the standard ones that you would think, are mostly involved in either distributing or manufacturing. And if they manufacture for the military or manufacture for those in the healthcare industry, then they are allowed to stay open. So we get through that list, and we move now on to business assistance. Again, a lot of this is going to need to be sorted out, but the best resource is either to call our office at City Hall, to Mayor's office, or be in touch with the North Central Mass Chamber of Commerce. They have a great website with just incredible amounts of information that is there for you, and take advantage of that. But more and more will be based on the stimulus that the federal government has passed. And we're all, ourselves, people at City Hall, at work in business development, the chamber, the national chambers, are all working to sort of decipher all of this so that we get a better understanding of what exactly that funding is, what the amounts are, and how we can better assist you. Are You OK program, we have talked about a number of times, but want to remind everybody, the police department will call somebody that's disabled, somebody that's a shut-in, or somebody has a medical disability. We want to check on them, make sure they're okay daily. They'll call at a designated time. If nobody answers 2 times, they'll send out an officer to check on them. To sign up, 978-534-7560, 3432. With just a couple of minutes here, if you want to post a question on Facebook, do so. We are sharing our personal Facebook page and streaming live. We're also here at Leominster.tv, and you can also hear this at 95.1 WLPZ. WLPZ also streams. They stream by going to WLPZ.org. So I know I saw some questions here. I might have missed them. If you want to retype them in, that is fine. We will go through the testing sites while we watch to see if there are any final questions. For the testing sites at Health Alliance, they're now open from 8 to 4, Monday through Friday. That is an expanded hours. They must have a doctor's note. You must email electronically or fax to the lab up at Health Alliance, and you must call this phone number, 978-466-2627. I don't know if businesses have to stay closed until the 4th as well. I don't have the answer to that. I think everything's really going to be based on the numbers that we see and how well we are at keeping our distance, washing our hands, sanitizing. All of that is critical right now because each one of us, even if you don't know you have it, and we have to assume we have it, because if you don't know you have it, that's really one way that can really start to spread uncontrollably is because you don't know you have it. You're just acting like you don't. Assume you do. Assume everybody you come in contact with does, and then assume that everything you touch, all surfaces, somehow or another has been compromised. So I don't know the answer to that. I'm sure we'll get the answer to that, but in Leominster right now, we're going to stick with that April date unless things change. So anyway, over at Reliant, testing started today. You have to contact Reliant directly for an appointment, and testing is for Reliant customers only at this point. Any questions? Again, there are a number of loan programs that the Chamber has. Again, 978-353-7600, or you can go to northcentralmass.com. Yes, the governor did announce, if you're just tuning in, the governor announced that schools will be closed till May 4th, which means we've got to step up our game. We've got to put together a citywide plan for the educational piece of this. I know the teachers thought maybe it was only going to be till April. I know a number of teachers have been doing as much as they possibly can to get the information out to their students and stay in contact, but I think it's time for us to step it up a little bit and start to put together what would be a routine, a regular school day using sort of online learning and other tools that we have available to us. We'll go through a couple more slides here. Materials are beginning to arrive here in the city. The federal government is sending aid. We have the United Way, as we said, is beginning to raise some money. It's been doing very well in terms of that. They want to help the community. Ginny's Helping Hands. We have a number of agencies that are trying to help out. If you need help, let us know. Don't go without. There are plenty of people who want to help. If there's a specific need, we'll put that call out into the community. So please, if you need something, let us know at City Hall. We are open. We're here. We're going to continue to do business. We are all essential employees. We are paid for by the taxpayer. We are your public servants, and we will work hard and work to the end of all this. I know we'll get through this. We'll work hard to get through this. And the public has been absolutely wonderful. Our city employees, committed, devoted, have passion and purpose, helping us to get through this, helping everybody that calls on City Hall, even if it's a state issue or federal issue. We don't just let it go. Is there any place to get tested? Yes, Health Alliance, and also Reliant, but it has to be done with a doctor's note. They have to fax or email electronically to the lab. There are kits that you can buy yourself. They are a little bit expensive right now for individuals that just want to be tested. As I understand in all of the reading and information I've gathered, eventually there will be a test, a little prick on your finger. They'll take the blood sample. The blood sample will tell whether or not you have it, but also to be able to tell whether you had it. And that's important because I think there are a lot of people at the very beginning of this pandemic that didn't know. They thought they had the flu, and they were healthy, so they made it through without any significant impact or adverse impact. However, that test will be able to show you that. That's down the road. I'm not sure how long it'll be till we get to that, but I am encouraged by the level of testing that is going on, not only here in the city of Leominster, but around the state. And my hope is that we've gotten and identified the worst cases, have them under quarantine, identify the less significant cases, quarantine them, and treat them so that they're not exposing that to anybody else. And that is the way we're going to sort of flatten the curve, as they say. So, simple. Assume you have it. Assume everybody you come in contact with has it. Assume every surface you touch or come in contact with is somehow or another compromised. Remember, this virus is in its own category. It does not like soap, and it does not like alcohol. So those are your two friends, and those are the things that the virus despises the most. Let's go to a couple more slides here real quickly here, and I know there's lots going on, and I want to try to get to some of the other slides here. Thank you to all of these local businesses and doctors and dentists and everyone in the community who have really stepped up. And I'll tell you, I mean stepped up to the point where we were able to help the hospital get our public safety, police and fire, EMS personnel, and also assist other communities in the region to make sure that they have the right protection in terms of their personal protection equipment. So thank you to them. Thank you to everybody. I know people have been out there helping others to get the shopping done, doing errands for them. That's the sort of spirit that we have to continue on. And it's us helping each other. This is community. This is what we're all about. Wi-Fi, if you want to get connected, download your emails, get some information, and you don't have internet access, go to the rear of the public library. And if you want to take a quick screenshot of that or a picture, you can. A number of stores have gone to a senior shopping hours. So the best thing to do is to call, Market Basket and Shaw's and Target and Walmart, or go to their website and find out exactly, including Hannaford, to find out what their particular hours are. I really would like if some of the supermarkets could gear themselves up with maybe taking orders. So if I wanted to call for my mother and I wanted to order online for her, that maybe they would deliver. If I don't have the ability to pick it up, but there might be circumstances where somebody doesn't live in the city, their parents do. They don't want their parents to have to go out and shop, even for these special hours. And they wanted to be able to online or send an email over with an order, have that order picked and delivered. We would even supply the manpower or the staff to deliver those orders. Leominster parks are open. If you do have to go out, keep that sort of personal space 6 feet apart. Again, I can't stress enough, FDA come out with some significant materials today. Go to the CDC website, but most of this is being passed on from person to person. And I don't have to explain how. I mean, all the obvious things like coughing and sneezing and, people that sort of lose driblets as they speak and share those, and you don't want them shared with you, and that's really how it's getting spread. So, yes, I'm sorry, Leominster CTEI also donated in a big way to Health Alliance. Didn't want to forget them. We'll add that to the list. Thank you, thank you, thank you. I apologize for not remembering that, but yeah, they stepped up. They went immediately down to the CTEI, pulled out all the materials they had, and got them up to Health Alliance. So I know people are going to get cabin fever. Think of where you are today. It's Wednesday. Think where you'll be another week from now. Think where your children will be in 2 weeks, in 3 weeks. And so getting out into the trails is absolutely no issue at all. There's 26 miles of hiking trails. All our parks are open. Stay off the equipment. Again, treat every surface as if it's been compromised. Stay away from each other. There's plenty of room to stay away from each other. If you get on a trail and somebody's coming, step aside, let them pass, and move on. Make sure that you have sanitizer later, and make sure everyone uses that sanitizer because, again, this virus does not like alcohol or soap. And especially when we get good weather, start thinking about, planning out what you're going to do. We're hoping tomorrow night to be talking about planting, doing some demonstrations on planting indoors. Maybe you used to do that. Maybe you stopped doing that. Getting your plants ready for the garden come May, and you always went out and purchased them, but now you're thinking, hey, it'd be really fun to get the kids together and let's plant some kale plants, and let's plant some celery, or let's plant everything that we put in the garden that typically we purchase. And, it hasn't been inexpensive to purchase plants lately. But they'll show you a different way. And so tomorrow night, we hope to have a demonstration and have some fun with that. So be thinking about how you're going to plan this all out if students are going to be home till at least May 4th. Let's get to the volunteer list. Twofold. If you'd like to volunteer, we're keeping a list. We could use your help. The Emergency Operations Center is staffed 8 to 8, and it's staffed with volunteers. If you'd like to volunteer, in any capacity, Here's the phone number, extension 5055. If you have a need and you need somebody maybe to help you out in something, then there's the phone number to call as well. Census, as I said, if you already got it, fill it out. This is the online version. Fill it out, get it over with. You will feel really good about yourself. You can celebrate and dance around the kitchen with your favorite song streaming. But either way, get it filled out, get it sent in. It's going to be difficult for the census this year, just because of everything that's going on. You can make their life and your life easier by filling it out and sending it in. We want to close by thanking all of our first responders and all those that work in the healthcare industry. It's tough out there right now. They are working extra hours and trying to do the best they can, some of them themselves with families, and they have to go home and not sure if maybe they carried that back with them, whether or not they are positive but maybe haven't been tested yet. So all of these things circulate. Those people at the grocery stores who are trying to do everything possible that they can, working really hard, variety stores and gas stations, and people that are able to keep those Dunkin' Donuts and places that have takeout food. You know, some of these businesses that are doing takeout food, this isn't exactly their strong position here. They're not exactly getting rich off of this, but trying to help their customers and help the community as well. Is the Searstown Mall open? No. The census I was given had the wrong address, so can I fill it out? I would correct the address, I would fill it out, and I would send it back. That's what I would do, and if that's incorrect, between now and January, they will let you know. Yes, the mall is shut down. Okay, if there are any other questions, you can always Facebook message me, you can always email me, you can always call our office. And again, a big thank you to everybody here at LTV. They're in early in the morning, they stay till late at night. We'll be doing our show tomorrow, and hopefully it'll be a cheery, positive show. And I want to thank everyone, again, all the volunteers at our radio station, WLPZ. FM 95.1, because they're staffed all day trying to get the message out. This is rebroadcast through the radio station in case you missed it here. And so most important, I'll repeat it again, I've really tried to reduce it so that it's a quick message. There's so much information that comes out that it gets confusing. So if you can remember this and nothing else, this virus does not like soap. It does not like alcohol. Assume you have the virus and act accordingly. Assume everybody that you come in contact with does, and assume that every surface that you have touched and come in contact with has been compromised. Panera Bread is open for takeout as of last week. Shop local, yes. I mean, businesses have been closed, some for 2 weeks now. It is difficult. It is really tough for many of the businesses that are here that aren't able to open and got shut down. And think of the people that cut your hair and do your nails and everything else in between. Just think about, you know, the impact to them. By the time we're through, almost everybody will be impacted in some way. And that's why we have something in common, and that is to stand tough and struggle together and help each other and get through this. We don't know what the other end of this all looks like. Nobody does. But I know one thing, the most important thing is for us to stay healthy and take care of yourself and others and check on others in the community. And again, we will get through this. So again, thank you for watching. We will be back tomorrow morning at 9, streaming just on our Facebook page and the Leominster Community Development page. But then we'll be back here at 4 o'clock tomorrow night to do another full update. And what we've tried to do is take all of the mounds of information that is out there and try to put it all together and reduce it to the important issues that affect you and how you might be able to take advantage of some assistance that either is out there available right now or will be. Okay, we're signing off for now. Thank you. Good night. Take care of yourself and keep that immune system up. Take care.